Just having some tech issues, trying to figure out what's going on, and I think we're almost there. Thanks for bearing with us. So I'm Tazrina Chaudhuri. I work at Institute for Sustainable Futures at the University of Technology, Sydney, and I'm the moderator of today's workshop, the last session of the day. And this is a Futures workshop hosted by Fred Hollows Foundation. Before we start, I'd like to do the acknowledgement of the country. I acknowledge the traditional custodians of the land on which we live and work today, the Gadigal people of your nation. I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people. I recognize their continuing connection to land, waters, and culture and acknowledge that sovereignty was never ceded. Welcome to the Futures Workshop. The workshop's called Building Local Ecosystems of Ethical Practice, Designing Research and Monitoring Evaluation and Learning for Context and Community and Share and Connect. And as I mentioned, the workshop will be facilitated by Fred Hollows Foundation, and we have Yadira Perez and Lisa Johnson with us in person, and then three other panelists online. So I'll hand over to Yadira and Lisa, and they can take it from here. Thank you.
Okay. All right. So we have three amazing panelists that are going to join us. I'm going to keep the possibility open. They're joining from China and Nairobi, and there's some serious technical difficulties getting them on. So today's in the Futures workshop, one of the things that we wanted to do here is get to work, really. This project, this workshop was an opportunity for us to deepen our conversation and then begin to map. The reason why I say this early on is because we had this very hybrid environment that we were hoping to do both online and in person. So because there are some limitations, we are going to have to kind of curve and flow. So please bear with us. And also, if you have ideas, please, we will be very open in identifying the challenges. So if you have ideas, please help. Yeah. Okay. Yeah. So yeah, one of the challenges with our panelist Amanda in China is that they're not able to even log on to the platform. There's a firewall. So they were hoping to get the link that would give them access to the Zoom. So I don't know if there's a possibility of still sending them the link. All right, we'll see what we can do. So I'll begin a bit in grounding, literally grounding myself because adrenaline is high, but also grounding the conversation. Um, so I want to ground us in the kind of complexity of building local ecosystems of ethical practice and the possibility of that task at hand. Localizing evidence generation in a way that's ethical, that's useful, which means relevant and lasting, is not a small feat. For many INGOs and the Fred Hollows Foundation as an eye health INGO in 25 different countries is one of those. This is a strategic mandate. This is something that we have put this in our organizational strategy for the next 5 years. For me, my name is Yadira Perez. I'm the head of operational research at the foundation. But for me, that mandate is personal as well as political. I was born in the Bronx, New York, though I live in Melbourne and Narm now, to Puerto Rican parents from a small island in the Caribbean that's deeply entangled in colonial and extractive relationships with the United States. My questions are also very much deeply embedded by my anthropological discipline. I'm an anthropologist, and my research in public health. And these this positions me in the ways that I begin to think about these questions of ecosystems, of evidence and learning. When I think about what's missing in evidence, what's missing in the enabling environments around learning, I, as an academic, an anthropologist before this, in university settings, but also as an oral historian at the Tenement Museum in New York City, which is an immigration museum, I kind of go back to my, I go back to text, literal scholarship that really kind of transformed my lived experience into kind of academic conceptual thinking. So Michael Ralph Trudeau wrote, and he was very big into thinking about what's missing in the archives. Silences enter the process of historical production at four crucial moments. And for me, what's left out really matters. So when I think about evidence and I think about learning, that is something that I keep a keen eye. There's also a great thinker, Gayatri Spivak, who is an Indian American scholar. And one of the things that she really drove on me to think about is, can the subaltern speak? Really, can the powerless, or those that are not in power, truly be heard by those who are powerful? That's another thing that I think about very deeply in the work that I do around evidence generation. In my role as head of operational research at the Fred Howells Foundation, I lend technical advisory services across hundreds of programs, working with hundreds of partners and dozens of country teams that collectively impact the lives of hundreds of thousands of people. And that is a task that I do so with much privilege and humbling, from a humbled position. I sit at the intersection of people and systems, and ensuring evidence is meaningful and rigorous and responsive to those it meets and it's meant to serve. And that sometimes is harder than I wish it was. Um, Though I'm a researcher and an anthropologist who is endlessly curious about people, I don't believe that we should be in the business of collecting data simply because we can. If evidence already exists, our responsibility is to use it, to apply it in ways that meaningfully improve lives and that actually is accessible in the ways that they can use it. Across 25 countries, I've seen the daily realities of evidence work, the maternal health volunteers collecting data in remote areas, the independent local consultants translating the context into insight, the ethics board asking hard questions, making sure we're thinking about ethical questions in that local space, and the researchers navigating shifting priorities and very limited and sometimes broken infrastructures. We know what's possible. And one of the examples I think about, which has its challenges, was COVID. COVID showed us that data can move fast and equitably. And if we look at, there was actually more spaces in which that happened than not, right? When we choose to, but I also sit in the stubborn kinks of the system, the power dynamics, the funding cycles, the mistrust around who owns the data, what you're gonna do about it, with it, and who benefits. So today isn't about figuring out a silver bullet of how we're actually going to tackle all that. Um, it's more so, it's about pausing and asking, what might it look like if we build and sustain ecosystems of ethical evidence, ecosystems that are grounded locally, but agile and connected globally. It's not a this or, it's a this and situation. So not sure if we'll have our panelists coming on. We have one here, Lisa Johnson, which is an absolute brilliant panelist. Um, so Lisa Johnson, oh, and we have Kennedy, wonderful. Um, okay, true, one second. So we have, so who we have today
Amanda?
will be a kind of surprise in the box kind of situation. But we have Lisa and we have Kennedy, who I will allow for them to introduce themselves. But I will say that each of these panelists have an in-depth expertise of development and other sectors that they're bringing. And the way that I wanted to introduce this conversation was for them to just share a story with you, kind of in a much more narrative format, even than I started off as. So let's see. Kennedy, give me 1 second. Can you just flip to the PowerPoint really quick? So our objectives really is to share real world examples of ethical context, um, context responsive evidence generation. And here, really, to generate a collective futures map of possibilities, tensions, and design principles. So we're really going to get some work going. And focuses are exchanged across locations, disciplines in this hybrid format. As you see, there's challenges, but I think we're up for it. So we're going to do this quick round of stories from the field. It may be that we do 2 stories, do Q&A, and might have another story or 2. We'll see, it's a surprise. And then go into the main work, which is these breakout discussions where we begin to map the ecosystems. And that gallery walk is really when we come back and begin to share. There'll be future provocations from those mappings. I really want to say not only this is what I imagine this ecosystem is, but the why, right? If we do this, then what will we see? And that's how we'll end with our next moves. So we have Lisa Johnson here, who's our Global Equity and Inclusion Lead. And then we have Kenny Alawena, who is currently in Nairobi, and he's our Monitoring Evaluation Manager in Kenya. Hopefully we'll have Amanda, who's our Cluster Director, who is leading and supporting China, Cambodia, Laos, Vietnam, and Indonesia. Just a small task. And Henry Mwangi, Senior Evaluation Specialist, who's supporting the 24 countries that we work with and is situated in Nairobi. And then you have me, your facilitator. So storytelling from the field brings data experiences to life, showing how integrity is shaped by real people, power dynamics, and the trust behind every number. So I want to shift now into these stories from the field. If we could potentially start with Kennedy, since we have him online. Oh, and we have Amanda. Wonderful. All right, Kennedy. So can you go ahead and lead us into your
Thank you
story?
very much, Yadira, for that powerful introduction. As you said earlier, my name is Kennedy Alwenya. I am a monitoring and evaluation manager working for the Fred Hollows Foundation Global Programs, and I am based in Nairobi, Kenya. I support development programs across countries in Africa, but more specifically in Kenya. Today, I have an innovative mail practice, monitoring and evaluation and learning practice from Kenya that has influenced the development sector, which I am pleased to share in this RDI Network Exchange 25 conference by focusing on the theme building local ecosystem of ethical practice. Um, Kenya is classified as a lower middle income country in sub-Saharan Africa, encounters challenges related to funding of development programs and complex programming approaches. Uh, our operating environment is complex due to work in remote rural areas to engage marginalized populations, requiring a variety of implementation strategies for each context. These challenges require strong monitoring systems and adaptable learning methods to address the changing environment. Our team has found out that fostering a continuous quality improvement plan enables clinical and development programs teams to effectively meet local reporting needs. Effective reporting increases donor trust and expands future funding options for Africa's development sector. Program teams and local partners also benefit from data and evidence that will guide future development strategies. Using dynamic templates, advanced learning management systems, and regular learning sessions have streamlined data collection, and reporting for program management and patient outcomes. We have customized templates to address the unique requirements of local partners and collaborating with them in developing these tools, which has fostered ownership and accountability in reporting. We also have adapted the use of advanced LMS systems, which facilitates resource sharing among local teams, global teams, and partners in various locations. And this is especially for the medical teams working on our programs. Across our programs, we do regular and systematic learning review and reflections, which help teams stay on track, and it's a valued improvement strategy. Looking into the future of development work in Africa and globally depends on the effective adaptation of these MAL strategies and approaches that generate robust evidence for successful intervention. Continuous quality improvement strategies have emerged as one effective approach. A successful continuous quality improvement strategy heavily depends on a multidisciplinary team and also support of the top leadership within a particular development program. Continuous quality improvement strategies will continue to play a key role in future development efforts across different contexts, and development organizations working in these diverse settings may use continuous quality improvement to track changes in their work. I want to thank you very much for this short story that I have from the field.
Thank you
Thank
so
you.
much, Kennedy. Since we're online, Amanda, our cluster director who's in China, can you go in? Can you start your story?
Thank you, Yadira. Can you hear me?
Yes, very well.
Okay, great. Good afternoon, everyone. This is Amanda Huang, speaking in China. I'm the cluster director for our work in China, Cambodia, Laos, Vietnam, and Indonesia. Thank you very much for this vital conversation today. We are here today to confront a very critical shift, and in particular in China's unique environment, marked by self-reliance, rapid technology advancement, strong governance, and also goals like common prosperity being promoted by our government stakeholder largely in recent few years. This shift is both essential and ripe with potentials. And by working in the field, I think we still have loads of challenges like navigating these complex stakeholder and systems, ensuring data sovereignty under laws like data security and privacy we have to comply with here locally, and achieving genuine local ownership, which is strongly possessed across different stakeholders. So our work in China really takes a evidence-based advocacy approach to support improved policy planning and practice to achieve the goal of universal eye health coverage. So the first question is, how do we define quality evidence here? I think it's not just one size fit for all. Globally, when we talk about quality evidence, normally we often means rigor and publishability. But locally here in China, for our communities, partner health facilities, government stakeholders, the definition shifts really dramatically. Quality here means relevance, which can answer the questions raised from our communities. It also means actionability, which we look forward to improve our program, and also credibility. The data needs to be gathered ethically and also respect the local laws and regulations. And secondly is to ensure we have true local leadership and ownership, not just about implementation. This really demands international shift, and it means our local partner leading on agenda setting. We define the research questions based on the needs of our local communities. And we also co-design the methodologies using local case studies, and also popular digital tools that has been widely used across many different sectors here in China. And we also wanted to ensure our local stakeholders, they own the resources, they have the ability to manage the budget, hiring local expertise, and importantly, they also take the ownership of evidence dissemination. So this is really about long-term partnership focus on capacity sharing and co-creation. For international NGOs like us working in the field, we're really working on creating sustainable ethical ecosystem, which means moving beyond just focus on project. We must invest in local infrastructures, ensure we have well set up MER unit, capacity, data platform that's aligned with local agenda and also system. And we're also trying to foster enduring networks, such as set up communities of practice and also encourage learning within and beyond China. And advocate for flexible funding, longer time frame, and crucially plan ethical exit from day one, which means ensuring local system maintain data and also continue learning, foster equitable partnership, embedding capacity strengthening in every steps. And therefore, we design the whole ecosystem for long-term sustainability and integration. Thank you. Thank you for listening and looking forward to more discussion with the participant later.
Thank you so
Over
much.
to you, Yadira.
Yeah. Thank you so much, Amanda. Now we have an in-house.
Hi, everyone. Thanks again for your patience today. My name is Lisa Johnson. I grew up here in Australia, and for the past 20 years, I've worked with communities in over 25 countries around the world. I'm currently the global lead at the Fred Hollows Foundation, where I have the privilege of supporting our country teams to embed equity and inclusion in our programming, including in research and evaluation. As a Caucasian, English-speaking woman from the global north, working in international development, I've come face to face many a time with the uncomfortable truth that many of our systems and processes we use to learn and to assess can and often do let people down. There have been many times when I've seen community voices reduced to a mere tick box exercise. I remember observing the rollout, fortunately this was quite some years back, of a survey in rural India where the questions weren't translated into local languages, into local dialects rather, and only a handful of people could actually complete them. Needless to say, there was a lot of frustration and the results were not terribly useful. I've also observed focus groups where poor rural women were literally herded in at the last minute because the donor rightly raised concern about the lack of female participation, only to see them sitting there, mostly in stunned silence, with no idea of why they were there, what was going to happen with the information that they were being asked to provide. There was no childcare provided, no travel support provided, and very little space actually to speak up. And then to learn that when they did speak up, their ideas and suggestions never actually quite made it to the report. Their presence was tokenistic, their time wasted. It's also not been uncommon to see evaluators talking, only interviewing senior officials instead of talking with frontline workers or community members, in effect, speaking to those who mirrored their own experience and spoke their language. I've also watched Northern Partners, and I've been part of this at times, so I'm not saying it's out there, design, analyse and write up research, leaving local teams to collect data without sharing authorship, expertise or credit. Fortunately, and more often now I can say, I've also seen what good and emerging practice can look like. In one community, I saw a team of researchers sit down with village health committees, local NGOs and our local team to co-create the research questions. The focus really was on learning together and making sense of that data together and determining priorities for action. In this case, local practitioners became co-designers, co-analysts, co-authors and leaders. rights holder organisations held seats on the steering committee and co-drafted the reports. And the result, a process that everyone felt part of, and actually recommendations that actually made sense and could be actioned. So now, before launching into a new study or evaluation, a key question that I ask myself is, whose data is this? Who is it for? Whose power can it unlock or withhold? Because our work isn't just about ticking those boxes, it's ultimately about supporting local decision-making, capacity and agency.
Henry, can you speak?
Hello, can you hear me?
We can hear you. We cannot see you, which would be nice, but hearing you is most important. So,
I don't know what's the issue with my,
oh, there you go. Hello.
you can see me now.
100%. Henry, it's your space.
Okay. My name is Henry Mwangi, and I'm based in Nairobi, Kenya. I work with the Fred Hollows Foundation as an evaluation specialist, and my role is basically to ensure that we are gaining good practice in evaluations that we are conducting within the foundation. I wanted to share just a small piece regarding how I see the mile space shifting in light of the shifting complexities in the programming environment. We are an eye health organization, and we are confronted with questions that are requiring us to evolve in terms of the way we are conducting our MAR. One of the questions that we find in our engagement is that when we screen patients with an expectation that they will come and be able to receive service. So for instance, we screen cataract surgery patients, and then in the hope that they will come and receive cataract surgery. But one thing that we are finding is that when we screen, not all come. And so the question is, who comes and who doesn't come? Is it possible for us to be able to tell who is likely to come so that we can be able to be more tailored in our interventions and so be more targeted? And the other question that we are finding in our programming is that we have an issue with diabetic retinopathy patients. So most patients are not completing their treatment. But is it possible for us to tell who is likely to complete a treatment? Rather than just taking a general or a cursory look at the general issues that affect all these patients, is it possible for us to be individual, to enhance the way we can analyze individual behaviors that predict one patient to behave in a particular way? On the other hand, while we get presented with these challenges, on the other hand, we are seeing that the mile space is also growing. The world is evolving with tools and systems that can be able to help us to deal with these problems, to deal with these questions. We have data science and machine learning. This provides us opportunities for us to be able to identify tools that we can be able to use to be able to address some of these questions that we are finding in our programming. For instance, we have tools like classification models that can be able to help us predict behavior and therefore be able to develop tailored solutions that target individuals We have things like survival analysis that can help us be able to tell or predict the time to an event. And in this case, an event would be a patient dropping from a treatment plan. So the question that we've been having is, how do we build our local systems to be able to adapt to these tools and systems that are out there? How do we enhance ourselves so that we are not just having, on one hand, we have the complex programming questions that we have to deal with, but on the other hand, again, having tools, but there's a disconnect to which we are making use of these tools. So my question to you is that I would love to hear from you. How are you bridging to ensure that these tools that are constantly being developed are being applied in your programming? Are there techniques that you people have applied that you think we can be able to borrow from so that we constantly keep changing and enhancing our local systems to be able to adapt to these tools that are being developed? So I'll be happy to hear from you, and thank you for giving me this space to share that insight.
Wonderful. Thank you so much, panelists. Before we go into a bit of group work, don't the opportunity to do some Q&A, some clarifying questions, or any points of interest in the stories that you wanted to connect with? Like if someone said that you sparked a memory or something experience, or even just a question you might have during the panel. The right shift from observer to participant takes a while. Yes.
I suppose this is a question to the sharing of Amanda earlier, when she said that the quality of evidence has to do much with relevance, actionability, credibility, and local ownership. Who determines these, and how do you basically determine that that relevance, that actionability, and credibility?
Amanda, did you hear the first part of that question? I don't think so.
Hello?
The volume, we can't hear. The volume is a bit low. Sorry.
Sorry.
Try that one. Okay.
Can you hear me now?
Amanda, can you hear me?
Yes, Yadira, I can hear you now.
All right. Hello. Hi. So I should probably introduce myself. Anton Palo from the Philippines. Earlier, Amanda, you mentioned that quality of evidence has much to do with relevance, actionability, credibility, and eventually local ownership. Who establishes these, and how are they established?
Thank you very much for the questions. I think based on our local experience here, the co-design approach is very important because, as you know, in China, we have to comply with very strict local regulations in terms of accessing data, using data, and how later, once we have the fundings, this should be used to inform either policy or practice. So for all the research work we're doing here in China, we ensure from the very beginning we engage with local stakeholders. So they are part of the design process. And in terms of the, I think in particularly the credibility, we as international NGOs, we also in another way play a kind of capacity building or empowerment roles to ensure our research partners or local stakeholders can also follow the international standards to ensure the credibility of data that we collected from the field is speaking to the truth and also collected ethically. I hope I answer your questions. Thank you.
Oh, no, just say hi. One more.
Okay, hi everyone, I'm Bianca Suarez. I'm from the Australian National University. I'm a project officer on research projects. Thank you for sharing your stories. I'd be very interested to hear, considering that Fred Hollows is this international NGO that works in all these different countries and local contexts. And how do you design your evaluation systems so that there, I guess, like is standardization across these different contexts something you consider, and in that process, how do you respect and acknowledge like the different local contexts that might make this kind of standardization difficult, if not impossible? I'd be really interested in hearing your experience with that.
Yeah, Kennedy and Henry, did you hear the question? Who would like to speak to that? You need to maybe come on.
We barely can hear Yadela.
Okay, did you hear the question?
Yeah.
Okay, so
I had.
yeah,
Let me.
yeah, go ahead.
Okay. Basically, what we have is that we have developed global standards and guidelines that we have introduced and made aware to the different countries that we work with. Again, we also have a research and evaluation policy that details some of the guidelines that are supposed to be followed. But then again, we also allow countries to develop their evaluations and their learning processes based on their context. So we have the high level, but again, we allow countries and projects when they are doing the evaluations to set up a team that is locally oriented so that they can be able to tailor the evaluations based on their local context.
And what I would say to add to that, there are several technical advisors that support the bridging of what's happening, what's being collected, and those standards, and the other way around, right? So if what's being developed locally, there is need for further support, whether it's more team members to collect the data or more time for the evaluation to be done, then there are these technical advisors that support the back and forth conversations for that. Bianca, I think as you alluded, it's not easy. And in our program, because we work in so many different places, we work in complex environments. We also have an Indigenous Australia program who has a very different evaluation system. Again, they are standards. They're more kind of international standards, but as well as deeper principles of data sovereignty that we are looking to expand across all our countries, but they're the ones leading for us and teaching the organization how to proceed.
Thank you so much. Can you hear me, everyone online? Yeah. My name's Meg Brodie. I lead the Human Rights and Social Impact practice at KPMG. It's really fascinating to hear all your stories. I'm interested to know, particularly as you talk about data sovereignty, the analysis across multiple countries, and how you both collect and hold that data ethically, how you might be considering the use or the responsible use of AI, either now, if you're already doing it, or the way that the organisation is starting to reflexively think about it, if you are. Yeah.
Well, our IT department has developed a policy for us and clear guidelines on the use of AI and where we can use it and where we can't. And we've also adopted the co-pilot system, and we're piloting that across the organisation. And largely because Copilot, as you probably know, has access to your SharePoint data anyway, so it's not like you're sharing, information with an external source that it doesn't already have access to anyway. We did do some trialing with ChatGPT as well, and we've decided to pull back from ChatGPT largely because of the risks associated with sharing potentially sensitive data, within the organisation. I mean, you can still use it if you want to tidy up an email or something like that, where there's no sensitive information. But if it's in-house information, related to policy or whatever it is internally, then that's a no. And we're also doing some training for staff around ethical use of AI. And also just building literacy around the use of AI in the organisation. So it hasn't rolled out to all staff yet. We're sort of building incrementally and learning as we go around where some of the challenges might be. In terms of the data sovereignty question, I think we've probably still got some more work to go, even in just sort of really understanding where the risks are. So we're sort of starting out slowly and then building. But then, I think there's going to be sort of further work to do around, what does this really mean down the track and what sort of extra safeguards do we need to have in place above and beyond what we've got currently? Uh-oh. Yes, yeah. Well, certainly, I'm aware that we've been testing the use of AI in diagnostic screening for diabetic retinopathy, and also in kind of other data collection tools as well, as yet, or retinopathy screening.
Yeah. So that's in places where there aren't ophthalmologists or people that can screen. Oh,
Yes.
practice. So yes, in areas, remote areas, and particularly in Australia, where you can't get ophthalmologists to do the screening. So there's been test pilots of being able to get health workers to take the pictures and then AI to be able to detect whether, so stuff like, so definitely that. In-house, in terms of case studies for AI, there's different projects, small little projects, and trying to figure out what is it that staff want AI to do. Because in some ways, we don't know what the desires are, right? Sometimes we think the worst. We think they're gonna, I don't know, create a whole new database. But actually, that's not. They want to go through their Outlook and see how many requests they received. So we're still there in those spaces. With data sovereignty, as Amanda has mentioned, China and Indigenous Australia, some data is not allowed out of certain countries. So that has forced us in really important ways to think about what data actually is needed to be exported, for what reasons, and then also locally, how that data that stays behind can get used a little more. So this is a space that I'm looking to be in conversation with. It's not something that we have completely figured out our stance, right? Because I think it's going to be continuously evolving. Right? But yeah, we're trying to figure all these things out in an ethical practice. Yeah. Because the thing about AI is that it is unethical not to use it in some ways, right? It's the inequities that are being, that AI is creating in terms of how much it's producing and who's producing it. So white, male, Western, right? It's creating massive inequities, right? So not using AI is causing. So it's an ethical issue as well. So we'll continue to navigate that story. So we want to move on. We definitely want to move into thinking about mapping potentially what can be a local ecosystem. And the way that we wanted to do this may need a little support online. So if you can pause here online for a sec. Well, here in this space, you'll see you have some sticky notes. And I'm thinking that maybe we just do 2 groups, and each of you will be creating different ecosystems, right? This is not about one all-encompassing one. So if we can kind of create 2 spaces, sorry for those who've warmed their seats. And then online, can we tell how many online participants we have? We have 7.
Does that include our?
Okay. So online, and this is maybe information for you as well. If you go on to the panel, into the panel on the app, there is a chat function. So it's not the Q&A, it's the chat. So if you go as if you were wandering around the agenda and you land on our panel, and this is for, yes, it's in the Hoover app. So you have to go into the Hoover app, go to the agenda, find our panel, and there you will have a selection for chat. Any hands who found it? Found it. Wonderful. All right. Amanda, Kennedy, Henry, have you found it? No. So online on that chat, you will have a link to a Figma board. The online community is going to use this Figma board to have their group participation in the mapping. So Henry, Kennedy, and Amanda, unfortunately, you won't be able to engage with the online participants only through this Figma. So everyone needs to enter the Figma link, and through it, you'll begin the mapping. For my team online, if you can communicate with me via the Teams, let me know if you're having any challenges. And then, Lisa, we can go on to the slides here so we can do the mapping. Sure. All right, so yeah, where's the clicker? Those directions have changed. So let's begin to map out pathways to a stronger evidence ecosystem to imagine and map bold, ethical, and locally grounded futures. So for the first 5, let's say 5 to 10 minutes, on those sticky notes, if as a group, if you can just start to kind of write down what are the challenges that you've heard both in the stories, but more so what you've experienced in the field when it comes to the challenges in how evidence is currently generated and used. What are some things that are working, and what emerging opportunities you do? So use this truly as a kind of brain space, right? A brainstorming space. The little sticky notes are there. You can decide to use different colors. But if you can begin to think about what are the challenges we're hearing, cool, let's put those down. What works if we've heard or you've experienced that? And what opportunities we haven't tried yet, but potentially could work. And this again, from your space. Some of you could be very new to development or come to development in a different field. This is literally, we're using this opportunity to dig into different type of experiences and figuring out what this evidence ecosystem could look like. All right, what are the questions for this? All right, Cool. So, yeah. So and I'll move on.
Oh, thank you. Thanks very much. You gonna join a table?
Yeah, yeah.
Oh, awesome. Okay, there's some space over here.
Yeah.
For the participants online, if you can go to the chat on the app and press Figma, you can join the mapping. You can kind of begin to share amongst each other. What are some of the challenges, what opportunities, what works. From there, we're going to begin to then have a discussion in your team. And then once you have discussion, you can kind of outline what's possible and move into a conversation about the actual map. Okay. So this conversation is important to kind of lay out the lay of the land amongst all of you and your team. So yeah, take the next 3 projects out. With the satellite images of a whole forest, and they just make decisions about their livelihood. As a team, I want us, the conversations are going well, so I want us to kind of take the next step about this mapping. Continue the conversations, include this. What would a more ethical, equitable, and locally driven evidence ecosystem look like? And here I have 3 dot points. Actors, who are the actors? Practices and principles, supports or structures. Please, if there's anything missing, add to that. But that was just kind of some probing. So moving from continue the conversation of challenges, what's work, what are the opportunities, to as a group begin thinking, what could work? What could we begin to map out? And then with these layers, act as practice work. And then just to show you, we will then begin to kind of here's a bit of an ecosystem. You're going to make some choices about what needs to be prioritized. We can't take everything with us, right? We need to really sink in. So before you make the choices, elaborate. Who are the actors? What are the practices and principles that are needed to create something new? That's you can be different, right? It could continue from the old, but something that you would define your ecosystem. So yes, continue the conversation and feed yourself into a future.
placements will be important to be able to re-articulate size in order to fulfill those performance. I don't know how that relates to ethics and accuracy, but it seems like it's I don't know if it's a necessary evil at the moment, given that we don't have things unfolding. That's just me applying some of the concepts.
Sure that as a team we're thinking about what those core values, the actors, enabling support. But we need to make choices about what the fundamentals are. Is the next So I feel like the data
Yes. So, it does have that. It does have that. Yeah, forward line. So I'm a lot of grandsons. I'm jogging you along the end of the pathway. As a team, we're going to go back and present to each other what is one core item in each of these areas. And if you added another area, please add the area. So it's a bit of discussion and negotiation about what core item are we going to present. Remember, in the perfect ecosystem, there's lots of buttressing. There's lots of stuff that is supporting it. But there is a core principle. There is a core actors that we want to center, right? So make a decision on what that is. And more importantly, if these core values, actors, ecosystem supports work in place, what would we see in evidence and learning, right? What future will we see if what you chose actually operated as so I'm going to give you about 4 things for that. Well, so what do you have? We're laying down exactly what a very technical bridge. I'm not really good on it. Yeah. I'll do it. Yeah.
Yeah, so that's what I'm saying. Yeah, but I think that's it. Like that's which they combine, work together, you know, so that work together and take or something that they. Oh, I think, all right, what I'm thinking about, you know, what would look like, if yes, it's a bit awesome. One I could couple parts to share, so if you can, in like 30 seconds. Yeah, exactly. In 30 seconds, can you just make a decision on that core? Whatever you do. Something that it's insolvency. You got this. Oh, evidence. Evidence is a system. Yes. Yes. That is an odd typo. I mean, techniques. Getting very awesome. Yeah. I know on the side. It's just when it's there and I'm going. All right, so yeah, answer that question. So this is honestly this is now. We're playing in mud. Yeah. So we'll go around that system. This was the code radio having this evidence system. I really want to hear back from the teams. So with 4 minutes left, I'm going to ask for our first volunteer in the team to just begin to share the core values that you've picked, and then what future does that begin to step forward? Which volunteer team? Wonderful. All right. So you're gonna evoke this. Oh, no. No, that's 30 seconds. Are we still on? Amanda, that's fine. Yeah, you can just. Okay. All right, let's go. You can ad lib as you go. All right, so we're going to start hearing from one.
Okay. So our sentence, I've forgotten the first half of the sentence, but basically it could be readily adapted to embed local knowledge in the evaluation system, to build ownership and trust in that process, and provide robust information and also benefits to community. It's that elements that are readily adapted, but the core value is around respect, recognizing expertise and rewarding that expertise, and actually using that knowledge to change or to make change.
Wonderful. Thank you. Thank you for that. Wonderful. Yeah, the respect and the use and the award, like actually being valued for what you bring to the table. Hasn't been mentioned much, but it's so important. Yeah. Wonderful.
So our core values was self-determination. I think we said a bit more things, but we never really nailed down how to phrase them. But when we were thinking about our end goal, like what do we want the system to look like, it was something that is relevant, uses local storytelling, and achieves the community's desired end goal. And one way we were just talking about how to support that is lobbying the funder to do some more of that early research or engagement work so we can really have those kinds of community-led or community-driven outcomes and projects, rather than just having to fit a project into a prescribed grants box.
I hear you. It goes, yeah, a much wider, or actually a representation of life, you know, of the growing thing. Kennedy and Henry, you represent our online. Can you just tell us your core and then what future is that leading us into in a beautifully brief statement?
Maybe I can say something, and Kennedy may come in and add. We looked at the priorities that we are seeing as we go towards this journey of evidence generation and use. We are looking at being able to identify the partnerships that we need. I think for a time we thought like we have been working more in a siloed approach. So all of us are in our different spaces. Then we are looking at how do we identify, be they our peers, be they the research institutes, be they the other local organizations, so that they can help us build this further. We are also looking at the leadership.
Okay, Henry.
At some point,
Yeah,
at some,
they're telling us we need to wrap up the room. Can you tell us what future would that lead us into?
it's in terms of leadership, I think what we are seeing is that we need to be intentional in a way to try and identify what is it that is out there that we need to do. As our ministries continues to implement their initiatives, are they keen to be able to tap on what is existing? So I think a bit in terms of collaborations, a bit in terms of identifying the leaderships and ensuring that we are inclusive in whatever that we are doing.
Thank you so much, Henry and Kennedy. And thank you to all of you for your patience, your engagement. And if you don't mind leaving your sticky notes there, I will take a picture of that and continue to kind of continue this conversation forward.
Thanks, Yadira. Thanks, Lisa. Thanks, Henry, Kennedy, and Amanda. Thank you, everyone, for attending the last session.